Welcome to this episode of In the Multitude of Counsel. Tonight we are excited to bring to you information about addiction. Now listen, addictions have hit households all over the nation. I know right now it's one of the most riveting topics and one of the things that we're dealing with the most as a nation. And so tonight we're going to bring you some information about it, give you some information on how you can help make change, give you some information on how to receive treatment. I am just elated to be able to focus on this issue and be able to help bring some real answers for real people. Stick with us tonight. I want to welcome tonight 3 counselors that are versed and have experience in working with clients that are dealing with addictions. I want to welcome tonight Damon Cobble, Shirley Miller, and Walter Harris. I am so elated. I have just been waiting to be able to talk about this topic, addiction. We understand that it is plaguing families and impacting communities, and it has a big impact on our nation. Even our president, guys, is making grants and different funding streams available to help combat this issue called addiction. And I am excited to have each of you tonight. Go ahead for a few minutes and introduce yourselves and where you're from and what you do, and let's get ready to talk about this issue called addiction. I'll start with you, Damon.
My name is Damon Cobble. I'm a licensed marriage and family therapist associate. I have experience working with individuals, families, group therapy, and also couples.
Okay. All right. Thank you. Shirley?
Awesome. Thanks for having me here tonight. My name is Shirley Miller, and I am a licensed marriage and family therapy associate. I have experience working with individuals, couples, teens, adolescents, kiddos here in the Louisville, Kentucky area.
Okay. And then we have our own with Creative Spirits, Walter Harris.
Yeah, my name is Walter Harris. I'm a counselor therapist at Creative Spirits Counsel Center. Been there for about the last 15 years, specialized in substance abuse therapy.
All right. Well, we welcome each of you tonight to our show. Let's just talk a little bit about addictions and what it is. And I really found a really strong working definition that I want to just kind of to start off our dialogue, and so that our audience can be clear about what addiction is and where it's coming from. This definition comes from the Department of American Society of Addiction Medicine. Addiction is a primary chronic disease of brain reward. It's motivation, memory, and related circuitry. Dysfunction in these circuits leads to characteristics, biological, psychological, social, and spiritual manifestations. This is reflected in an individual pathological, pursuing reward and/or relief by substance use and other behaviors. Addiction is characterized by the inability to consistently abstain, impairment in behavioral control, craving, diminished recognition of significant problems with one's own behaviors and interpersonal relationships, and a dysfunctional emotional response. Like other chronic diseases, addictions often involve cycles of relapse and remission. Without treatment or engagement in recovery activities, addiction is progressive and can result in disability or premature death. That gives us a strong definition, because we know this thing called addiction impacts us on all life areas. We're looking at biological issues, we're looking at psychological, we're looking at social issues, and we're looking at spiritual manifestations of this thing. And the other thing that we know about it is that it hits the reward center of the brain. And all addictions, whether we're looking at gambling, and tonight we're going to talk about gambling addiction, we're going to look at sexual addiction, and we're going to look at substance abuse. And we know all of those hit that reward center of the brain that gives pleasure. But let's talk a little bit, Walter, tell us a little bit about, as we unfold and look at this addiction piece with substance abuse, how this thing progresses and a little bit how it can entrap people towards addiction.
Well, I love the definition that you give, because it really encompasses the whole thing of addiction. And the thing that I have noticed over the years is that it begins as an experimental thing. Okay. People begin to experiment with drugs. And as they begin to experiment with drugs, alcohol, whatever it is that they're using, that they become addicted. It could be a substance, it could be a situation. But usually what happens, they go from there into what we call a social use. Social then they start to seek that buzz or that pleasure center thing that happens in the brain.
Okay.
And as that, it moves into abuse, and from abuse right into addiction.
Okay. And that's a great example of how this thing progresses. And that progression can be, is it short term, or I know sometimes we've seen some that can go over a span of years.
Yes,
Yeah.
it's not instantaneous. Most of the time it does progress over a period of time. And it does have some genetic predisposition influences too, as well as social and environmental.
Let's just kind of piggyback on what he's talking about and talk about in terms of sexual addiction, Damon, and let's kind of fold that on in there. As we're going to bake this cake towards addiction, let's just kind of fold each of those addictions in, and then we can just kind of continue our conversation. So fold that in for us about the sexual addiction.
You know, that is a great definition, but I also believe it's important to understand the traditional the difference between the traditional definition and the more modern term definition in terms of sex addiction or porn addiction. You know, when you look at the traditional definition of addiction, it pretty much you've had to have some type of physiological withdrawal, unlike sex addiction. And now with the more modern understanding of sex addiction, you know, there's a lot of controversy when it comes to this specific addiction.
Okay.
So we have to be very careful on how we explain it and how we view it and how, you know, we elucidate the totality of it. And so the more modern approach is defined with it being more mental,
Okay.
with or without a physiological withdrawal.
Okay.
So
okay.
you have the traditional definition, then you have the more modern definition, and then I just think it's important to differentiate between those two.
So as we're talking about sexual addiction, then we're looking more, when we're talking about psychological or mental, then our solutions, as we get on a little further and we fold that in, then we're going to be looking at some psychological processes in order to help them. Even though it hits that same reward pleasure center, the entrance is what you're saying is more of the psychological piece of that.
Correct. And also with sex addiction, it's just like there's a lot of parallels between sex addiction and also heroin addiction. You know, they both create a pathway in the brain. They create that pathway to the reward system. And so the more you do it, the progression, the process, the more you're looking for that fulfillment, the more dopamine is released. And so you would progressively, it get worse, it would intensify, and then that's when it can lead into some illegal activity as well. Voyeurism, peeping Tom, and even rape situations.
That's good. That's good to kind of note. So we're looking at emotional, psychological, physiological, as well as psychological. And then let's fold on in that gambling addiction and talk about that as it relates to addiction as a general term.
Yeah, and the other thing I think that we really have to think about, lots of people gamble. We have the boats, we have casinos, you know, we have the lottery, different things that people do. One of the things that lets you know that there's an addictive nature into it is that it starts to impede on the productivity of your everyday life. So for example, if I, you know, scratch a card every week just because it's something that I do, that's just kind of my deal. But if I spend my entire paycheck on, you know, gambling, pulling slots and everything like that, then that impacts me in a negative way. I know from the standpoint of gambling, even statistically, as of late, I believe the last statistic said that there are maybe about 2 million people in the U.S. that we know of that struggle with some type of gambling addiction. And what's very interesting about this particular one, similar to pornography and sexual addiction, a lot of it is done in a very secretive type way. You know, you may have people that do these things, you know, within the realms of a casino with friends, but nowadays you can go online and that type of gambling is available for you 24 hours a day.
Absolutely.
And so a lot of times family members are not even aware until after a major kind of thing has taken place that this has been an issue that their loved one is struggling with.
Okay, that's good. That's good. I want to keep that conversation going because you all have given us some real good workable definitions and looking at the differences between the addictions. And I see that each of them, when we start talking about it, it's progressive. And I know when we deal with, at our center, at our counseling center, we deal with substance abuse, and we start with that experimental stage. Let's talk a little bit about that and how that pathway, Walter, how that pathway gets connected from experimental to social, and then from social to harmful, and when it starts to hurt me. I know we use 3 critical words that the people in recovery use, which is cunning, baffling, and powerful.
Yes.
And it's almost like a sneak attack, and I'm hearing that about what you're saying. I'm hearing that about what you're saying. It's a cunning, which means it's really sneaky. You don't know that you're getting caught up in addiction until it starts to hurt you. Or we also know it's baffling, which means it causes confusion, because when people are telling you, hey, you may be having some problems with, looks like you're having some problems, you're confused and you're thinking they're against you, not understanding. So let's talk a little bit about that. So I know we deal a lot with that.
Well, when you start looking at the experimental stage, most people are not really trying to really get addicted. So when you start looking at what's really happening, that pleasure center is activated. Mm-hmm. And when you get all that chemical release of dopamine, that gives them a great amount of pleasure. So after really the first time they get high, they're really trying to recopy that and capture that same feeling over and over again. Mm-hmm. And then what happens is you begin to move into a social circle where you begin to operate with people who are doing the same thing that you are doing. Mm-hmm. And then it kind of moves, because what happens after that period of time that we don't even recognize, that it changes our thinking. Mm-hmm. Our way of even viewing the world, our whole perception changes. And as our perception changes, we begin to seek more of that pleasurable thing. And I think, in my experience, what I believe, that a lot of people use it really to deal with anxiety. Mm-hmm. Because the more you move into it, the more guilt we have, particularly if it's secretive.
Yeah.
Yes, absolutely.
And that guilt begins to drive us to go deeper.
Yeah.
And then before we know it, we're either in trouble,
yeah,
or we spend a lot of money, or we're having family issues,
yeah,
which becomes into that harmful state.
Yeah, and I think I love the way you're describing that, because it helps us to be able to see when we're talking about that what becomes in the driver's seat is the pleasure.
It's the pleasure.
And we start seeking that good feeling, or we start seeking that feel-good piece.
Yes.
And that becomes in the driver's seat beyond our people, our family, right, or anything. And before you know, I like that. Before you know it, it's starting to hurt you.
Yeah.
That leads us to the solution part. This was our solution for making us feel better. Well, now the solution is part of the problem. So now what do we do next? When we come back with our next segment, we're going to talk about that. What happens when the solution that you use becomes the problem? Stay tuned. We'll be right back. This episode was brought to you by Creative Spirits Counseling Center, transforming lives into creative spirits. 3 locations: Shelbyville, Louisville, and Danville, Kentucky. Okay, so now we're going to deal and talk a little bit about the process of addiction. And I really want to kind of go in depth in this conversation a little bit and look at how the addiction itself kind of processes. And, understanding, and we want to make sure that you're understanding that although when we talk about addiction in general, we're talking about different stages, each addiction has its own property, or has its own kind of stages, our own distinction in its progression. And so I just want to kind of give some information. We want to give you some information on what those distinctions are in looking at the process. So let's look at substance abuse first, and then we'll fold the rest of those on in.
Well, mainly what really happens with substance abuse as you move into addiction is you begin to give up hobbies and things that you love. Family becomes less important. Your job, you start missing days at work. And as you begin to move further into the addiction part, you may even wind up with some legal trouble. And those things begin to happen gradually and sometimes quickly. Yeah. But the important thing is that the addiction, the thing that you're using, does not falter. You hold on to that. Okay. Everything else begins to fall off, but you don't even notice that you're losing out on family, on legal stuff. It's coincidental. Yeah. It's not really as though it's important to you.
Yeah.
And we always make excuses for it. And we always go back to that which we were using.
Yeah. Yeah. I know some of the things that you and I have talked about too is looking at that preoccupation piece. A person becomes preoccupied, like on Monday,
Yes.
you're thinking on Friday how I'm going to get high, or what I'm going to drink, or I've worked hard all week, so I can't wait until I get a chance to experience that, and then preoccupation, blackout,
Yes.
and increased tolerance. Talk a little bit about blackout and increased tolerance for us.
Well, in the experience in the counseling center, what we've discovered is that a lot of times people black out. They still operate.
Yeah.
They may be driving, they may have conversations with people, they may even be playing pool or whatever, but the next morning they don't remember it.
Yeah, yeah.
And it's like it's totally gone from their memory. I've given an example of that I know of is a gentleman having a fight with his wife, and he wakes up in jail and doesn't even realize how he got there.
Yeah, yeah.
And that whole process had actually happened.
Yeah.
So the blackout is one thing. Tolerance increases.
Yeah.
Where maybe if it's alcohol, 2 or 3 beers, now all of a sudden I'm drinking 12.
Yeah.
But it's still in one setting, and it's just increases over a period of time.
Yeah, yeah. And that's important. I think those terms are important. That preoccupation piece is
Well,
important.
and you talk about preoccupation, and you start thinking about how I begin to plan out what I'm going to do.
Yes, yes.
And we've even seen people who plan not to do it.
Yeah.
But then there's triggers. There's environmental triggers. There's time triggers. Certain times of the day.
Yeah.
If you think about marijuana, you think about 420.
Yeah.
That's a number that people have equated to smoking.
Yeah, yeah.
So there's a lot of preoccupation. There's a lot of triggers that we have to keep an eye on because they automatically trigger that action to go back to use that pleasurable drug.
Yeah, yeah. And then you pile all those things up, and then you get to what we call full-blown addiction.
Right.
And that's definitely characterized by total loss of control. And, that's something. So you jump from that harmful piece,
Right.
that hurt me. I'm experiencing consequences now from my use. And now I'm just full loss of control. I don't have any control at all over it. Let's fold in a little bit about gambling and just kind of continuing in that vein of looking at how this disease itself progresses.
Well, and like so many addictions in general, you start off very much in a place of, like we said, that try it stage. And what's interesting with gambling, it can be centered around financial, but there are lots of different myths behind it. Many times people think that, well, gambling is just something, if you have a lot of money, then, it's no problem that you can gamble all that you want. But one of the key things, and you mentioned this, whenever that addiction, that money, that drive that you're dealing with starts to impact your everyday thought process, it starts to impede your ability to have healthy relationships. You start to let go of those things that have given you pleasure in the past, then it's impacting you in a very negative way. Another thing is, a lot of times for some individuals, as they begin to get wrapped up in that gambling addiction, what you'll notice is that what started off as just like a $5 bet, all of a sudden it turns into, if you have lots and lots of cash, it could be like a $1,000 bet because you're always trying to outdo what you did the last time. Or for those who are trying to stay in a place of secrecy, unfortunately, you may find yourself trying to win things back so that loved ones are not aware of what it is that you are battling with.
Yeah.
And so you think about, you've heard stories in the past of the man who gambles everything away and he hasn't paid the mortgage on the house, and the house is going to be repossessed. Well, you can't make that money back fast enough. The fastest way that he knows to make that money back is to make the next big bet.
Yeah.
And it gets you tied into a place like we talked about. Gambling in and of itself is not an illegal thing, but as people try to take bigger risk, they start to fall into the possibility of falling into illegal, types of gambling, and that's where things really